Good morning, all. Today, we are discussing about space management and space maintenance. Space management is an important responsibility of general dentist as well as pediatric dentist, because early loss of primary teeth can lead to development of so many problems, that is long-lasting and severe. The premature loss of primary teeth can lead to loss of arch length. This in turn cause crowding of the permanent dentition, impaction of permanent teeth, aesthetic difficulties that will affect the self-esteem of the child and cause malocclusion and some other problems such as development of aberrant habits, etc. Space maintenance begins with good restorative treatment. In case of proximal surface caries, there is loss of arch length that can be prevented by giving a good restoration. The best space maintainer is the natural tooth itself. Before going to space maintenance, we need to know about certain terminologies, that is preventive orthodontics. It is the action taken to preserve the integrity of what appears to be normal occlusion at specific time. It's given by Graeber. And interceptive orthodontics, it is the elimination of existing interference with the key factors involved in development of dentition, given by Profit and Ackerman. And corrective orthodontics include comprehensive procedures undertaken to correct the fully established malocclusion. Preventive measures or preventive orthodontic procedures are caries control, parent counseling, care of deciduous dentition, correction of occlusal interferences, space maintenance, abnormal frenal attachment, which can lead to development of midline diastema or causing the interference to the eruption. Such type of frenal attachments are identified or diagnosed early and do the correction. Then treatment of locked permanent first molars and abnormal oral muscular activities. Interceptive procedures are space regaining, correction of anterior and posterior crossbites, elimination of oral habits, muscle exercises for proper development of jaw, removal of soft and hard tissue impediment in the pathways of eruption, then resolution of crowding, interception of developing skeletal malocclusions. In our society, the deciduous dentition is given least importance because the deciduous teeth have to exfoliate eventually and permanent dentition will come. But maintaining the integrity of deciduous teeth and occlusion leads to the preservation up to exfoliation, which in turn forms one of the most important steps in preventive orthodontics. That is, if the primary tooth is lost earlier, it will lead to crowding as well as the loss of arch integrity. So, what is space maintenance? Space maintenance is provision of an appliance that can be active or passive, which is concerned only with the control of space loss without taking into consideration measures to supervise the development of dentition. Space maintainer means it's a fixed or removable appliance designed to preserve the space created by the premature loss of teeth. Space maintainer is an appliance that is used to preserve the space. Then sequelae of premature loss of individual tooth. Loss of primary incisors. What will happen if the primary incisors are lost prior to the eruption time of permanent incisors? Usually this primary incisors loss is given little or no clinical attention unless severe closure of space is noticed. The sequelae resulting from premature loss of primary incisors can affect aesthetics, quality of life, eating, speech development, arch integrity, development and eruption of permanent successors, and development of oral habits. So, if primary incisors are lost at an early age, there is increased chance of development of aberrant habits such as tongue thrusting, because there is a space is available in anterior segment. So, the child shows a tendency to thrust or push the tongue into that particular space. That will in turn or later it may develop into tongue thrusting habit, and then of course it will affect the speech or phonetics, because if the anterior teeth is missing, there is chance of developing lisping. Then it will affect the self-esteem of the child. The child may fear to or scared to do smile or pronounce some words, etc., because others will humiliate him or her. So these are the sequelae of losing primary incisors. In loss of primary canines, usually the primary canines are lost because of the erupting pressure exerted by the lateral incisors. If unilateral canine or one side from the canine is missing from the one side, it can cause midline shifting, and there is increased chance of lingual collapse of incisor segment. If the teeth is collapsed, then there is development of deep bite. If bilateral loss, again pronounced lingual inclination. There won't be any mesial shifting, but the development of deep bite and loss of arch perimeter will happen if bilaterally canine is lost. Then loss of primary molars, that is loss of interproximal contact area or contact with the adjacent tooth, or extraction or ankylosis of an adjacent tooth results in space loss because of the mesial and occlusal drift of the tooth distal to the newly created space. Usually, if the primary molars is lost, the distal tooth, that is second deciduous molar or the erupting permanent first molar, will drift mesially, as well as if it is lost during the time of eruption of incisors, then the canine, the anterior segment will shift to the distally, and both these can cause space loss or arch perimeter loss. Then coming to objectives of space maintenance, that is important thing is preservation of the primate space and preservation of integrity of dental arches, then preservation of normal occlusal planes, and if the anterior space maintenance, it will help in aesthetics and phonetics, etc. There are so many factors that need to consider before giving space maintenance of space maintenance appliance. That factors, we are discussing that factors now. That is, one is time elapsed since tooth loss. The maximum space loss happens during the first 6 months of after the loss of primary teeth, and it is maxilla is showing more space loss than mandible, because maxilla has got a cancellous bond. So the bodily drifting of the tooth happens and there is more space closure. Then stage of development or the dental age of the patient. The amount of space closure is usually less if the permanent molars are fully erupted into the occlusal interdigitation. And if the first primary molar is lost prematurely before the eruption of permanent incisors or during the eruption of permanent incisors, there is increased chance of movement of canine to the canine distally. This will again cause increased space loss. And space loss is more if the tooth is lost earlier, that is before 4 years or before 6 years, more space is lost. This is because more tooth movement is happening during the eruption of permanent molars as well as during the eruption of incisors. The amount of space closure, in case of maxillary second primary molar, more amount of space is lost, that is approximately 8 mm of space loss, and in case of mandibular second primary molar, 4 mm space loss is happening in an average. Then if the space loss is high, as we discussed earlier, then the loss of primary molar happen during the eruption of permanent molar. Direction of closure. And in case of maxillary arch, bodily movement of the permanent molar will happen, and that is mesially and mesiolingual rotation of the permanent molar that will cause the space closure. In case of mandibular posterior teeth, mesial tipping of the permanent molar is happening. There is no bodily movement. The permanent molar is tipped mesially, as well as distal movement of the anterior segment. that is canine and the incisors. An eruption timing of permanent successors. Usually the permanent tooth erupt when more than 1/3 of the root is formed. And the eruption timing may be, the effect on eruption timing may be differ depending upon the age of the patient. It can be delayed or accelerated depending on at what age the primary tooth is lost. Studies shown that loss of primary tooth before the age of 7 years cause delayed eruption of the permanent tooth, and if the primary tooth is lost after 7 years, there is increased chance of accelerated eruption or early emergence of the succedaneous tooth. That is, if the primary molars is lost at 4 years, then there is chance of 1 year delay of emergence of premolar at root completion. And if it is occurs at the age of 6 years, delay of 6 months is noticed with the root completion. Then the presence of the amount of bone covering the unerupted tooth. If the bone covering is depending upon the thickness of bone present on the succedaneous tooth, if it will take 4 to 6 months to erupt through the bone, through the 1 mm of bone. The bone covering can be assessed using wiping radiographs. And some cases, like in case of buccal abscess or bone resorption, in such cases, there is accelerated eruption is seen. An action of abnormal oral musculature, especially the strong mendalis muscle pattern, cause negative effect on the primary molar loss. That is, it exerts forces on canine as well as the incisors that cause collapse of the dental arch and distal drifting of the anterior segment. Then we need to consider about the absence or presence of permanent tooth. If the succedaneous tooth is congenitally absent, then there is sometimes it doesn't need any space maintenance. So before giving space maintenance, the presence of normal successor must be ensured through radiographic evaluation. Coming to treatment planning. Prior to the treatment with space maintenance, some steps should be followed. Like we need to take complete and accurate medical history and examination to evaluate the general and dental health of the patient. That is, if some medical conditions, like if the patient is epileptic, we cannot give removable space maintenance. And if the patient is having immunocompromised condition, such patients we cannot plan for a distal shoe space maintenance, etc. So a complete medical and dental history is needed. And radiographic evaluation should be done to know the eruption status of the developing tooth bud as well as the amount of bone covering, to know the amount of bone covering. Then a good set of diagnostic models need to be prepared for model analysis. According to Profit, the treatment planning is as follows. Like if the missing primary teeth with adequate space, then we need to give space maintenance. And if a primary first or second molar is missing, if there will be more than 6 months delay before the permanent molar eruption, permanent premolar, that is succedaneous tooth is eruption, then we can give fixed unilateral appliance. And both sides molars are missing, that is bilateral loss of primary teeth, then and already the incisors have erupted. In such cases, we can plan for a lingular space maintenance. And early loss of a single primary canine in mixed dentition, we need to give a space maintenance, or we need to extract the contralateral side to prevent the mesial shifting or midline shifting or the distal drifting of the tooth. If contralateral side canine is extracted, then we need to give a lingular space maintenance to prevent the arch collapse. Coming to ideal requirements of space maintenance. It should maintain the mesodistal dimension of the space created by the lost tooth and should be functional if possible to prevent the over eruption of opposing tooth, and it should be as simple and strong as possible. And should not interfere with the normal occlusal adjustments and not endanger the endanger the remaining teeth by imposing excessive stresses on them, and it should not interfere with the normal vertical eruption of adjacent teeth. It should maintain the individual functional movements of the teeth and easily adjustable. And its construction must be such that it does not restrict the normal growth and development process. The space maintainer should provide mesodistal space opening if needed and must be easily cleansed and should not serve as a trap for food debris. And it should be durable and corrosion resistant and should be reasonable in cost. Indications: when second deciduous molar is lost prior to second premolar eruption, or premature loss of deciduous first molar, congenitally missing second premolar, loss of first permanent molar after the eruption of second permanent molar, etc. And coming to contraindications, if the radiograph of extraction region, that is the development of the development of succedaneous tooth, if more than 1/3 of root formation is completed, then no need of space maintenance. Or when the space left by the prematurely lost primary tooth is greater than the space needed. In such cases also, no need of giving a space maintenance. That is, if excess space is present and there is no tendency to tendency towards closing space. And when there is general lack of sufficient arch length and severe crowding is present, in such cases, space maintenance would further complicate the existing malocclusion. So, if we are planning for a serial extraction or that much crowding is present, no need to give a space maintenance. And when succedaneous tooth is absent and when malocclusion is inevitable and subsequent orthodontic treatment is required or orthodontic extractions are needed further, in such cases, no need of giving a space maintenance. And when the size of dental base is adequate for the size of the teeth, and when premolars are about to erupt, or when well-developed occlusion and cuspal interdigitation is present, that will prevent the mesial or distal drifting of the tooth and space closure. In such cases, no need to give a space maintainer. Coming to classification of space maintainer, according to Raymond C. Thoreau, it is classified. He classified space maintenance into removable type, complete arch, and individual tooth space maintainer. Removable space maintenance include like acrylic partial dentures or complete dentures. Then for complete arch, it can be lingual arch type space maintainer or non-sculptural arch or the extraoral anchorage, etc. And individual tooth space maintenance examples are band and loop, distal shoe, etc. According to Hitchcock, it's classified into removable, fixed or semi-fixed, with bands or without bands, functional or non-functional, active or passive, and combination of the above. According to Hendrickson, he classified space maintainer into fixed space maintainer and removable space maintainer. Fixed space maintainer is again divided into class 1 and class 2. Class 1 is further divided into functional and non-functional type. Functional means ponding or the tooth replacement is done. Non-functional means loop type or bud type. Then coming to class 2 means cantilever type, like distal shoe, only one side is supported. Then removable space maintainer is acrylic partial dentures. So Hendrickson's classification broadly divided into fixed and removable. Fixed is again classified into class 1 and class 2. Class 1 is again classified into functional, non-functional, and class 2 is cantilever type. Coming to removable type of space maintenance, that is when there is multiple loss of primary teeth, then we can give removable type of space maintenance with an acrylic base. It may be made with or without labial bow and occlusal rust, depending upon the type of space maintainer we are designing. Classification, it can be functional or non-functional. Functional means the tooth is replaced, and non-functional means just an acrylic extension is given to act as a space maintainer. And then, of course, with or without class. Below it are classified removable dentures for children as class 1, unilateral maxillary posterior, class 2, unilateral mandibular posterior, then class 3 is bilateral maxillary posterior, class 4 is bilateral mandibular posterior, then class 5 is bilateral maxillary anterior and posterior, class 6 bilateral mandibular anterior and posterior, then class 7 one or more primary teeth or permanent anteriors are missing, and class 8 is complete loss of primary teeth. Advantages of a removable space maintenance, that is, it is easily cleanable and permits teeth to be cleansed, and it restores and maintains the vertical dimension. It can be used in combination with other preventive procedures such as habit breaking appliances, and it can be worn part-time, allowing the circulation of blood to the soft tissue. Then it serves in other important functions like aesthetics, phonetics, and mastication. Helps in keeping the tongue in bounds, and it stimulates the eruption of permanent tooth, and it doesn't need any band construction. Then dental checkups for caries detection is very easy, and we can make room for erupting permanent teeth without changing the appliance. Coming to disadvantages of removable type of space maintenance, the patient may not wear it. The patient compliance is very important. Why? Because if we cannot make sure that whether the patient is wearing it or not, and it may be lost or can be broken by the patient. Then lateral jaw growth may be restricted if the clasp is incorporated, and it may irritate the underlying soft tissue. Coming to some type of removable space maintenance is such as one is acrylic partial denture. And it is used in case of multiple tooth loss, either in maxillary or mandibular arch. To minimize the breakage, we can give steel lingual bar, which will strengthen the acrylic part. Then stainless steel wire clasp can be given, especially in primary canines and molars on both sides. And if the permanent incisors are in active stage of eruption, then this clasp need to be removed, because during the eruption of permanent incisors, there is slight distal drifting or distal movement of the canine is happening. And if we are giving a clasp on canine, it will restrict the movement of canine. So in such cases, after initial adjustments, we need to remove the clasp. Then we're coming to removable distal shoe space maintenance. And distal shoe space maintenance is given in case of loss of second deciduous molar before the eruption of permanent first molar. And if it is for a short period, and that is loss of second primary molar is at a very short time before the eruption of first permanent molar. In such cases, we can plan for a removable distal shoe. Advantage is that it is very easy to clean and absence of complication of intragingival extension, because it won't interfere with healing process. Then disadvantages are high level parental motivation and child cooperation is needed. There is an acrylic extension that will extend into the alveolus of the lost primary tooth, and that extension is removed after the eruption of permanent tooth. Usually, the eruption of the permanent first molar is guided by the distal surface of the second deciduous molar. If it is lost prior to the eruption, there is increased chance of mesial drifting. To prevent this, we are giving an acrylic surface to guide the erupting permanent first molar. The terminal end of the space maintenance exerts some pressure that act on proprioceptive receptors. Then it will permit an eruption without mesial migration. Removable distal shoes are preferred because it is simple to fabricate and place and maintain the integrity of gingival tissues. Avoid complications of subgingival appliance. Coming to another type of removable space maintenance, that is complete dentures. Sometimes all primary teeth of a preschool child may be recommended for extraction. In such cases, we can plan for complete dentures. The construction of dentures will result in improved appearance, and it will help in phonetics as well as it will guide the eruption of permanent teeth. The denture have to adjust it, and portion of it should be cut away as the permanent incisors erupt, and posterior border should be contoured to guide the eruption of permanent molars. And once the permanent molar and the incisors have erupted into the oral cavity, we can use a partial denture. These are all about the space maintenance and removable space maintenance. We have discussed the factors we need to consider before doing a space maintenance or giving a space maintenance appliance, as well as we know about the different types of promovable space maintenance. Thank you.